Hi everyone, thanks for taking time to complete this survey. It's focused on ending the HIV epidemic in Wayne County. To begin with, I'm going to provide you some background information about the ending the HIV epidemic in Wayne County, and then Katrice is going to provide you with some data to complete the survey. The Ending the HIV Epidemic Plan aims to end the epidemic by 2030. The plan is based on numerous advances that we've made in HIV prevention and care over the last 20 years. The goals of the plan are to reduce new HIV infections by 75% by 2025, and then to reduce them by at least 90% by 2030. There are 4 pillars to the plan. The first is based on diagnosing all people with HIV as early as possible. The second is getting people quickly into care and treating them. The third is around prevention of HIV transmission by using PEP and PrEP. And then the fourth is about how we respond to potential outbreaks and clusters. The focus of the plan in America looks at the areas where 50% of new HIV diagnoses are occurring. There are 48 counties that are included in the plan and 7 states that are in that have a substantial rural burden. You'll see that the only area in the state of Michigan is Wayne County. Last fall, the Detroit Health Department submitted an application to HRSA requesting $3.1 million for the first year of a 5-year project. Beginning on March 1st, 2020, Detroit Health Department received $1 million for the first year of that project. The lower than expected award requires us to think about how to revise the plan because we can't do everything that we originally had wanted to do. And so this is one of the steps of community input, is having you complete this survey and provide us with some of your thoughts. Here's a timeline of our engagement. We started with a presentation to SEMHAC, the Part A planning body. During the month of October, we'll have this survey out for folks to complete, and then we will be talking to some existing groups and doing some focus groups. In November, we're going to do a couple more groups and phone interviews with people living with HIV, and then finally in December we'll put all of this together and provide it to the Detroit Health Department so that they can figure out how they'll move forward with the planned response. So this is where you come in. Since we can't afford to do everything that we wanted to do, we're asking you to help us identify which of the following focus areas are the most important. So specifically, we're asking you to think about, if addressed, which focus area is most likely to help end the HIV epidemic in Wayne County?
Thanks, Leanne. Now I'm going to go through the 6 focus areas and provide you with a little bit of data about each one. But before that, how were they chosen? So what we did was we went from a previous needs assessment and planning activities, and then some data and outputs from our quality steering committees, and we had a longer list. So then we came to SEMHAC and some other groups like the Rhine-White providers and had them prioritize this list, and that's how we got it culled down to the list that we are getting ready to run through with you today. So number 1, increase education and work opportunities for people living with HIV. Why? Because education and work is important. We know that 71%, so nearly 3/4 of Part A clients live in extreme poverty, and we define that as less than 138% of the federal poverty level. And 98% of Part A clients are living at less than 400%. And then in Detroit, people are less likely to have graduated high school or have a higher degree than in Wayne County, Metro Detroit, or Michigan residents. So if you look at this graphic, you see the blue bar represents high school graduation or higher, and in Detroit, 80% have achieved that compared to 90% in Metro Detroit. The disparity is a little bit greater for those who have a bachelor's degree or higher. We see that in Detroit, it's 15%. Compared to 30% in Metro Detroit. So if this focus area were selected, we would work on increasing educational attainment and work opportunities for people living with HIV in Wayne County. Number 2 is to mobilize young MSM to reduce HIV stigma, increase social support for engaging in care, and increase literacy about HIV treatment. Because young MSM are a key population. If you look at this graphic, you can see the green arrow shows that in overall Wayne County, there are nearly 8 cases per 100,000, but if you look to the young Black MSM, that rate is much higher. It's over 1,500. That disparity doesn't only exist among diagnoses. If you look, that is carried throughout the care continuum, and that disparity is seen at each stage. So young Black MSM is represented by this light blue bar, and we compare it to the dark blue bar on the far left. You can see that they fall behind the overall Metro Detroit at each stage. If selected, this focus area would mobilize young Black MSM to reduce HIV stigma and increase social support to help other young Black MSM more successfully navigate this care continuum by getting into care and becoming virally suppressed. Number 3 is to reduce HIV stigma among people living with HIV and in the community, because stigma harms people in Metro Detroit. We know that this happens at every level, that people worry about going out and they have guilt about living with HIV and face social discrimination. This data comes from interviews with people living with HIV in Metro Detroit. So if selected, this focus area would work on reducing stigma throughout the community. Number 4 is increase engagement in care and viral suppression among Black MSM by having Black MSM develop an intervention that would be specific to them. We often use this graphic of 100 people because if we randomly selected 100 people living with HIV, this is most likely their demographic breakdown. So we can see that the majority of people living with HIV are Black men and or gay and bisexual men. However, Black MSM are rarely at the forefront of making these decisions. We know that the decision makers are not always reflective of people living with HIV, even though they should be. So this focus area would make Black MSM the decision makers in developing programs and services. Number 5 is improve housing stability among people living with HIV and decrease homelessness. Housing is healthcare. Data continually shows us that people in stable housing always have better health outcomes than people who are not in stable housing. So if we look at our specific data, we know that 7% of Ryan White Part A clients are homeless, and this includes those unstably housed or in temporary transitional housing. Also, if we look at our transgender population, that though they only make up a small percentage of our overall client population, like 3%, however, 16% of our transgender clients served in 2019 experienced homelessness. Number 6 is use data to identify and engage people living with HIV who are out of care or are not taking medications. The data tells us where we need to improve. So if we look at this care continuum, we can see that things are not changing fast enough. From 2017 to 2019, there have been minimal improvements across the board, and in the case of maintained undetectable, it has actually decreased. And then if we look a little bit closer at viral suppression, we can see that from 2009 to 2018, there have been minimal improvements. However, we're reaching what is called the care ceiling. So this graphic is from Metro Detroit, and it's telling us that people cannot become, soon people are not going to be able to become virally suppressed if we do not get more people into care. So this focus area would really concentrate on using data and proven strategies to get more people into care.
So what we want you to do next is complete the survey below. The data that Catrice presented will help you make decisions and answer the questions. We want you to keep in mind which of these focus areas, if addressed, are most likely to help end the HIV epidemic in Wayne County. We know that all of these focus areas are important, but we want your help and identify what we should work on during the first part of the End the Epidemic project in Wayne County.